Hello, everyone. Good morning, good afternoon, depending where you're joining us from across the country. Thanks for being here with us today. My name is Stephanie Cowle, and I'm Director of Knowledge Translation at Parachute. We would like to begin our session today first by acknowledging the land on which we live and work. For Parachute, we are located on what has been for thousands of years the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, the Métis, and the Mississaugas of the Credit First Nation. So today, this land is still the home to many Indigenous people, and we are grateful to have the opportunity to live and work on this land. And while we're all meeting today on a virtual platform, we encourage you to take a moment to acknowledge the importance of the lands we each call home. And from coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Our session today, before we move into the content, we need to take care of a few housekeeping items. First of all, to let you know, this session is being recorded. All of you as participants and registrants will be notified when that recording is available to view and to share with others. We're going to have a few presentations today, and at the end of the session, my Parachute colleague, Claire Westmacott, will pop on and join us at the end to facilitate a question and answer session. We do really encourage you throughout the entire webinar at any point to submit questions and comments that you have in using the Q&A function. At the end of the webinar, we also want to mention that you will be prompted to help us with completing a webinar evaluation survey. And this is so valuable and helpful for us to understand the value of these types of initiatives and ensure that what we're doing is helping us all learn and share knowledge. So we appreciate you taking a small amount of time to answer those questions that you're posed at the end. And we'll give you a little reminder about that in a little bit. All right, so getting into the topic of today's webinar. Our topic today is Cannabis and Edibles Poison Prevention, Exploring Parent Attitudes and Behaviors. And so we're going to be providing an in-depth look at child cannabis poisoning trends and key issues. And I'm so pleased to be joined by a few colleagues who will help offer different perspectives on the topic. I'd like to start by introducing Margaret Thompson. Margaret is a physician trained in emergency medicine and medical toxicology. She practices emergency medicine in both inner city and remote communities. Margaret is also the medical director of the Ontario, Manitoba, and Nunavut Poison Centers. She has a position of assistant professor at the University of Toronto and teaches senior medical trainees all they need to know about toxicology. Margaret also represents the Canadian Association of Poison Centers and Clinical Toxicology as the president at multiple forums nationally and internationally. Also with us to provide this Poison Center perspective is Jacqueline Burke. Jacqueline joined the Ontario Poison Center in January 2009 as a certified specialist in poison information. She graduated from George Brown College and Ryerson University's Bachelor of Science in Nursing program. Jacqueline started in respiratory and thoracic care and moved to ICU in 1999. From 2000 to 2007, Jacqueline worked in Jeddah, Saudi Arabia, and Abu Dhabi in the United Arab Emirates. And in 2008, moved to the Oakville ICU. Jacqueline holds emergency, oncology, and critical care certificates. Thank you, Margaret and Jacqueline, for being here today to provide your valuable perspective. We also have with us Annika Chasse. Annika is the director of the Cannabis Compliance Promotion and Policy Unit in the Controlled Substances and Cannabis branch at Health Canada. In this role, Annika's team is responsible for assessing regulated parties' cannabis promotional activities, delivering license holder school, which is to help new federal license holders understand the legislative framework, supporting public safety in its work to curb the illicit market, and administering administrative monetary penalties and ministerial orders under the Cannabis Act. Annika joined the Cannabis team portfolio in 2017 to support the implementation of the Cannabis Act and has over 20 years of public service program and policy experience. Thank you, Annika, for joining us today and bringing that federal monitoring and regulatory perspective. And I think you'll find over the next few presentations, we'll have a pretty well-rounded look at this issue and lots for all of us to think about, especially thinking about collaborative approaches on how we can work together to address this issue. So without further ado, I'm going to be starting with the first presentation of today. All right. So just to begin, as I mentioned, I'm the Director of Knowledge Translation at Parachute, and we are presenting this webinar today together with Health Canada. And Parachute, if you're not familiar with us, we are a national charity focused on preventing serious and fatal injuries in Canada. And that's a broad subject when we look at the leading causes of injury in Canada. So we focus on a few different priority areas. And these include fall prevention, especially in seniors, road safety, concussion, and the issue of poisoning. And the focus for my presentation today is going to be about a survey that we completed in 2021, a national survey we developed and implemented together with Ipsos to learn more about parental knowledge, attitudes, behaviors when it comes to not just poisoning, but specifically poisoning related to edible cannabis products. We had actually done a similar study in 2019, and this was a follow-up to that to see if there were any changes in the trends and to continue informing the work that we're doing. So as I go through the results from our 2021 survey, I will be able to point out some comparisons throughout the presentation between the 2 years of data. One of the reasons we needed to pursue this particular survey is while we actually have quite good monitoring of cannabis use behaviors, attitudes across kind of the Canadian adult population in particular through such ongoing studies as the Canadian Cannabis Survey and the National Cannabis Survey, those don't specifically focus on parents. And for this issue, we really wanted to be able to understand that specific group, what gaps or opportunities there may be for knowledge and behavior when it comes to cannabis edibles and poison prevention for children. So we thought it was really important to pursue getting this information specifically for this audience and this population. What we were looking to get out of this survey is, as I said, to understand parental knowledge, attitudes, and behaviors. We were, over the course of the project that we've developed this survey within, looking to use these data and these findings to inform an ongoing national awareness campaign. And I'll mention that a little bit later. With this campaign, again, we were targeting parents, targeting cannabis edibles related poisoning. So looking for this information to inform, what we want to target with that campaign and what behaviors we might want to be looking to drive change in, and the best ways to reach parents. So the methodology of the survey, it was a online survey through Ipsos's existing online panel, a short 10-minute survey that was available through any internet accessing device. The survey was conducted in both English and French, and we had a sample size of 1,000 Canadian parents. And for this, our definition of children were ages 14 and under. We did, because we were focused on cannabis, we did reach out to 500 parents who identify as cannabis users and 500 parents who do not, but then the data were weighted to account for that, but that's not representative of the population. We also weighted the data in the results to gender and to geographic region across Canada. So what are some of the findings? Starting with cannabis use, over 37% of parents, overall 37% of parents report cannabis use, and mostly for recreational rather than medical reasons. We specifically asked them if they consume cannabis or marijuana, and these were the responses to that. When we look at sort of in the results, where were there some significant findings? Male parents are more likely to use cannabis. So 40% of male parents reported this as compared to 23% of female parents. Also younger parents more likely to use cannabis. So parents under the age of 35, 45% of them reporting cannabis use, compared to 32% in those aged 35 to 44, and just 21% in those 45 and older. So we're seeing a trend with the age of parents and whether they identify as cannabis users or not. And this is consistent to what we found in 2019. So this seems to be a consistent trend, at least for now. We also asked parents about the types of cannabis products, the forms of cannabis that they consume. And so, as has been traditionally the case, we found that smoking and vaporizing are still the most common forms of consumption. There was a statistically significant increase in cannabis edible consumption from 2019 to 2021. And perhaps, looking at this timing, the impact of legalization being a factor here. We also need to consider potentially the impact of the COVID-19 pandemic, looking specifically at the 2020-2021 timing of our post-survey. And when we look at, if we look at the chart, you'll see a division between store-bought edibles and homemade edibles. And when we look at the increase from 2019 to 2021 around edible consumption, that is being driven, according to the report, by an increase in use of store-bought edibles, so through that market. Again, parents under the age of 35 are significantly more likely to be consuming edibles compared to the other ages. Something interesting to note, we also asked about frequency of use of all these different forms of cannabis. And so while use of smoking and vaporizing is very high in terms of the number of people that consume in that form, they also report consuming quite frequently, whereas with edibles, we are finding people report they use it less frequently. So while 46% of users say they might smoke or vaporize daily or almost daily, only around 20% who reported consuming edibles said they would do that daily or almost daily. So we're looking at a less frequent use for edible forms of cannabis. And we're particularly interested in how parents are, or other family members are storing cannabis products in their homes. As we know, safe storage is a key aspect of evidence-based prevention for creating barriers to children accessing these products mistakenly. So among parents who consume edibles, 54% report keeping them in their original packaging, and 42% report keeping them in a child-resistant container or package. When we asked about the different forms of storage, we gave several different options, and we defined sort of the ultimate, or we defined based on the literature that the best practice for safe storage ultimately is keeping products in a child-resistant container, and then further keeping it behind a barrier in a locked compartment of some sort, out of sight and reach of the child. So when we applied that definition of best practice to parent responses, we found that 27% of parents are actually properly storing their edibles in this way. Now, the vast majority of parents who use cannabis, when we ask them about whether they feel it's their responsibility to safely put away their cannabis, 75% strongly believe this. And I'm going to talk a little bit more about that sense of responsibility a little bit later. And it's one thing to have a place in your home to store products and think that's the place for where that goes. But what happens when people are immediately after people are using this product? We know, similar to medication, if the cap is left open, then the container and the storage behavior can't do its job. So we also ask parents to report, when they are using cannabis products, particularly cannabis edibles, after they access the products themselves, are they putting them back in that safe storage space right away? And the vast majority of parents who do consume edibles reported that they put their cannabis away immediately after using it, always or most of the time. And we found that female parents were more likely to report doing this, 81% of female parents versus 72% of male parents. And we also found that the answer was more likely to be always or most of the time among older parents aged 45 and older. We also asked questions that related to various attitudes and perceptions around cannabis risk, social acceptability of cannabis, what parent concerns might be. And so nearly all parents agree it is easy for a child to mistake cannabis edibles for candy or sweets or other products that are food products. We also saw that 80% reported agreeing that cannabis edibles should not be made to look like candies, sweets, and other kind of safer food grade edible products that children would have access to. However, worry over their children accessing cannabis edibles by mistake, either in other settings outside the home when they're visiting other places, or if people are visiting the home and bringing edibles with them. A worry over that among parents is relatively low. So there might be an opportunity to think about, beyond the home, how do we create safe spaces for our children when it comes to putting up barriers to access cannabis edibles. We also asked about, whether parents are proactively taking precautions to hide their edibles. So again, keeping things out of sight even during use. And interestingly, a small proportion of parents report that they actually have eaten cannabis edibles in front of their children, which is certainly something that we advise against, knowing what we know about children's imitative behavior. And again, just looking at parental knowledge and attitudes towards the potential risks and harms of cannabis, there does seem to be nearly unanimous agreement that cannabis can have long-term impacts on children, and that children might be more impacted by the effects of THC. And then also, particularly when we're looking at homemade edibles, and we may also argue edibles that are produced, that are accessed through the unregulated market, it's hard to determine the potency of those particular products. So strong awareness of parents in these areas, which points us to maybe that we should be focusing in other areas in terms of our messaging. If they understand these points, so what's the next level of understanding and behavior change we need to activate? We're particularly interested as well as, if a poisoning or an exposure should happen, are parents aware of the services provided by poison centers? Obviously, poison centers wouldn't be accessed in an emergency situation, but important resource for parents to be aware of, that we have this amazing specialized knowledge and service here in Canada. So for start, we asked parents about what they would do if their child consumed an edible by mistake. And pretty much the predominant answers were around either calling a poison center or calling 911 We did see a decrease in 2021 of the number of parents saying they would take their kids to an emergency room. That number was higher in 2019. And again, we have to think about the potential impact of COVID-19 and perhaps hesitancy to physically go to a hospital during this current public health crisis. Interestingly, non-users were more likely to report that they would call a poison center in this case than cannabis users. So again, cannabis users here might be a group to really target with increasing this knowledge and awareness. And so we asked directly, are you aware of the poison control resources in your area? And just about a third of parents are aware. So again, this is an area where we'd really like to see improvement and awareness of parents of what they can access should these incidents occur. And I mentioned coming back to talking about responsibility and how parents see their role in the prevention of their children accessing cannabis edibles mistakenly. And we provided a pretty extensive list of different potential stakeholders, individuals, and agencies in a child's life, in a family's life. And 71% of parents reported that they were responsible for keeping their kids safe from these products. You can see some agreement that there is a role for federal government, for cannabis companies themselves, for public health and other levels of government, but really parents seeing that it's their responsibility to keep their kids away from these products, or vice versa. And then as follow-up to that, because for responsible, they could pick as many options as they wanted, they could select many. We then asked them to select the single most responsible. And again, parents really seeing themselves as having a strong individual level of responsibility here. So in terms of these results, what are some of the takeaways that would inform maybe where we focus some of our opportunities and priorities for reaching out to parents with more information about cannabis edibles, about preventing children's access to them, and then also what to do in the case of an exposure or a possible poisoning. So what we're seeing from this survey is that, and I think generally across other information for other populations across Canada, that consumption of cannabis edibles is on the rise, and it is on the rise among parents specifically. If we're looking for those who are more likely to use cannabis and have these products in their homes, then targeting male parents and also younger and new parents seem like great opportunities to reach those where we can have some serious impact. With the legalization, and then also changes in terms of the social acceptability of using cannabis products, and specifically about newer forms of cannabis edibles, then those younger parents under the age of 35 are a really key demographic to reach right now. And of course, reaching newer parents, they'll have that information as their children grow and develop. And so we'll probably see that use shifting to be, across the parent demographic. We do need to continue to emphasize safe storage, and also being very specific about what we mean by that. So it's one thing to say, make sure you safely store your product, but we need to give parents specific definitions of what does that mean. So they may perceive that what they're doing is the safest possible option, but being specific about keeping these products in child-resistant containers, out of sight and reach of children, preferably in a locked compartment, just like for other products such as medications. Being really specific with that guidance is important if we want to kind of see a specific type of behavior change in people. As we saw in the results, parents do have a sense of responsibility around keeping their kids safe in this respect. And so that is something I would say we can leverage. If they see it as a responsibility, let's empower them to be able to do that. Certainly, we want to focus also on regulation, packaging, system level, and wide impact approaches. But when it comes down to communicating with parents, we can talk to them on that level of they see it as their responsibility. So here's what they can do to feel good about what they're doing with respect to keeping their kids safe from cannabis poisoning and other harms. And finally, just that emphasis on really increasing awareness of poison centers and available resources. This is something that we want to do across the country, but is also something that can be done with a regional focus. And just before I wrap up, I wanted to mention a couple of the public awareness and education initiatives that we have. That these have been ongoing, but also are upcoming in 2022. I mentioned that this survey, along with our 2019 survey, were initiated to inform a public awareness campaign. So the images that I'm showing on the screen are from an earlier round of this campaign that for which we use the hashtag high and locked, showing kind of that exaggerated using hyperbole to show that cannabis edible gummy product locked away as high as possible on top of various Canadian landmarks across the country. And so we're currently in the process of developing the next phase of what this campaign will look like, and are looking to launch this campaign out, really targeting the parent demographic this March. We'll also be participating with our partners across the Canadian Poison Prevention Network to observe and implement Poison Prevention Week, which takes place March 20th to 26th this year. And we will be talking about poison prevention more broadly, but we will include a focus on prevention of poisoning of children with cannabis edible products. You can access more information about these campaigns and general public facing information that we have on our website at parachute.ca. Okay, I'm now going to hand over the virtual mic to our next speaker. So Margaret, if you want to hop on video and share your presentation screen. I welcome Margaret Thompson and Jacqueline Burke.
Okay, can you see me now, Stephanie?
I can see you and Jacqueline, your faces.
Okay.
And so if you want to share your screen, that would be great.
Okay. And can you now see my screen?
You are perfect, Margaret. Good to go.
Okay, great. Thanks. So thank you for the introduction, Stephanie. And thank you to Parachute for giving the Poison Centers a chance to participate in this webinar, because it does give us an opportunity to advance our views as to how parents and others can prevent some of these poisonings and the exposures that happen in pediatrics. So without further ado, I just wanted to do a quick introduction to poison centers in Canada. For the majority, Canadians are covered by provincial and local poison centers. And there are 5 that provide services across Canada. The green area there is the area that on the Ontario Poison Center covers. And so we cover the province of Ontario, Manitoba, and the territory of Nunavut, providing based on our mandate to provide acute care poisoning advice to the public and to healthcare professionals when someone calls the poison center about how to care for a patient. Our calls are all answered by highly trained nurses and pharmacists in toxicology, and they first take the intake calls from the public or a healthcare provider, and they give, based on their resources, their knowledge, skill, and judgment, information as to how to care for that patient. And they would escalate that to a toxicologist, escalate the call to a toxicologist should the poisoning be so complex that they would need further advice as to how to care for that patient. Besides the mandate of giving advice on how to care for the acutely poisoned patient, all poison centers, take part in poison prevention activities. They collaborate with Parachute, for example, with the federal government, with different media sources to advance the poison prevention messaging. We all do some education and some research into how to prevent poisonings and care of the poisoned patient as well. I would also give a shout out to the IWK Poison Center, which is about to rebrand itself. They I think as of January the 1st, started covering poison prevention advice to Newfoundland. So the only province that doesn't have an official poison center is that of New Brunswick, where calls are answered by an 811 operator in that particular province. So cannabis legalization dates that are significant to poison centers are the date that medical marijuana became available as a prescription, and that would have been June of 2013. In October of 2018, cannabis was legalized for personal use, and edibles in October of 2019. And this really corresponds to what we see in poison centers as being significant dates as to when poisonings started to increase or exposure started to increase in the pediatric population. So these are statistics from the Ontario Poison Center. And although this is a bigger land area and population area than the other poison centers, imagine that these statistics came from all across Canada. We saw that pediatric exposures gradually increased slowly as cannabis products became more available between 2013 and 2018. But then with legalization, our numbers went up significantly. So that the exposures to children under the age of 12 were 244 in 2019. And at the completion of last year, we had almost 1,000 exposures in children under the age of 12 at the Ontario Poison Center. And then if you look at the whole country, we would have significantly more exposures in pediatrics as compared to our baseline prior to any legalization of cannabis-containing products. Because of that we have recognized that there's a very significant increase in these pediatric exposures, we actually have a specific pediatrics cannabis protocols for the use of our poison specialists and the public as to when what might happen if your child was exposed to cannabis. So if there's general information that's meant there for the consumer, and there's more specific information about the THC and CBD content being highly variable, even when they're in labeled commercial packaging. And for the most part, pediatric exposures, even if it's the green leafy part of the cannabinoid plant, these exposures are going to be ingestions. And the pharmacokinetics of an ingestion are different than that of inhaling or smoking or snorting your product. And we get a variable response. We get slow and erratic absorption, and it can be up to 6 hours after a cannabis edible exposure that a child becomes symptomatic. And once they become symptomatic, they can be symptomatic for much longer periods of time than were it to be an adult who had smoked or snorted their product. So this influences what we do as a poison center. We try to make an evaluation of how much cannabis a child may have had exposure to, but for the most part, it's very difficult for us to quantify how much THC would have been in a homemade product, a non-regulated product, for example. So we send any child under the age of 12 to a hospital for evaluation if we become aware of that exposure within 6 hours of the exposure, because it might be that they get symptoms later. And if they're already symptomatic, we send them to hospital to be observed for 24 hours so that they don't develop some kind of life-threatening exposure. There is no good evidence about a dose minimum. So even if we knew that the child only had exposure to 10 milligrams of THC, for example, children's responses to THC are very variable and unpredictable, and it could be that they get symptoms from very little amounts. If you look at some of the literature, it is recommended that an adult, 70 kilos, who has never used cannabis before, start with 2.5 milligrams of cannabinoid as their introductory dose to see what happens. And imagine a child taking 10 milligrams, because on a weight basis, that might be a lot more. These are pictures of some of the products that parents have called the Poison Center about when they've discovered that their child has been exposed to these particular products, and they call the Poison Center for advice. So in the top left-hand corner is the packaging that is allowed by Health Canada. It can be, not imitate some kind of other product on the marketplace. It has to have the THC symbol on the product, and a unit package can have no more than 10 milligrams. Look at Stony Patch. Each extra strength gummy can contain 160 milligrams of THC. This whole bag of Fruit Loopies can contain 500 milligrams of THC. And we said an adult who's never had it before should only have 2.5 milligrams. We can't guesstimate how much THC would be in these homemade cupcakes, for example, or muffins or brownies or many other products that are produced from homegrown THC and then added to the products. These things are not necessarily heterogeneous or homogeneously mixed as well. So one muffin might have a whole bunch of cannabinoid in it, and another muffin may have none. So we can't make predictions as to what might happen to that particular child for the most part. So what happens when a child ingests a THC product? I'm going to hand the presentation over to Jackie, who is going to tell you about the symptoms and that can happen and some of our recommendations for prevention of these sorts of exposures. I'm going to mute myself and stop my video. And
I think you're already muted. Hi, I'm Jackie. So I'm going to start with our first case, and we picked one out of the 700 cases that we saw in the last year with regards to children exposures. Mark, you pop to the next slide. So with our first case, we had a 2-year-old child that we initially got a call from the family member who wasn't at home with the child and wasn't sure about how much this child had gotten of the 500 milligram bar. Our specialist did advise that this child did need to go to hospital for an assessment, which is what they did. So within the hour, child was brought to hospital by, I think, the mother. And at the hospital, with the investigation and sort of the questions, mother had realized about the exposure about 9 o'clock. So sometime probably around 8 o'clock, but we're not even sure 100% when the ingestion occurred. The child did appear quite drowsy at the hospital when he arrived, was open his eyes. His pupils were very dilated, was quite rigid, but his vital signs were okay. Heart rate was a little high, but is not unusual for a child when they're not in their normal environment, of course. Anyways, so at the first hospital, they were concerned because they did not have any inpatient pediatrics. So we did recommend that the child go to a larger center where they did have the ability to monitor the child a little closer. So next slide. So when the child did show up at the next facility, he was quite confused. And so that was a bit of the concern. The physician, when they called us about them, the child wasn't very awake. They had to basically give the child a bit of a sternal rub to get him to arouse. eyes were closed, but wasn't really interacting at all. They did blood work and they did put in a catheter, and the child was minimally responsive even with that. And which is a concern with a 2-year-old child, because usually they are a little bit more vocal, of course. Though luckily, this child didn't have any seizures, didn't require any sedation. Blood pressure did get a little low, so they did have to give him some IV fluids. Heart rate and blood pressure were a bit better. But anyhow, they did have to give him supplemental oxygen, unfortunately, to support the child at the next hospital, and was in the pediatric intensive care to be monitored. So that's always concerning for us when a child does need more support than normal. Anyhow, throughout the day, the child did seem to improve. By the next day, he was more awake, a little bit more irritable, settled more when the mother did come around and was able to lie with the mother in the bed. But at the 48-hour mark, child's symptoms had dissipated and the child was discharged home later that day. Next one. So what are the other common symptoms, as you can see? And it's hard, and this is why we always refer the children in when it's less than 6 hours since the ingestion, because some children, and the majority, we've been fortunate, have been fairly asymptomatic. So when we've called for a follow-up, they've been able to be discharged home. But unfortunately, quite a few children either remain quite agitated or have a decreased level of consciousness and do end up staying in hospital, sometimes 24 to 48 hours like the previous child did. We haven't in the last year had any children that did require to be ventilated, but quite a few did have to go up to a pediatric ICU setting for further monitoring. And as you can see from our slide below, a lot of children do have vomiting, but we usually see them being quite drowsy or quite agitated. Most of them are usually bedbound, so they're not getting up and walking luckily for us. But we fortunately haven't seen any children in the last year have any seizures, or be induced to a coma state where they're not responsive. Next slide. So our role at the Poison Center is when we get a home call, we're listening to what the parents are telling us, trying to decide how long has the exposure been. And if it's been more than 6 hours and the child's symptoms have improved, we will advise that they can stay home and, in that there's nothing further to monitor for. But if they'd called us earlier, we probably would have recommended the child go in. We do educate and talk to them about sort of safe storage. We also do have on our website a little link to Parenting with Cannabis that we will advise them to look at and to see further information. And we will reassure them that fortunately their child either did have minimal symptoms or they didn't develop symptoms, but next time to give us a call, earlier. When we get a call from the hospital, usually it's quite early, within an hour to 2 hours, sometimes still a little later, and the parents have brought the child in because they are quite symptomatic. We will go through our protocol with them, advise them what kind of treatment advice, whether it's just plain monitoring if the child has no symptoms, or if the child is quite symptomatic, they may need to do some blood work, and how long to monitor the child for, depending on the symptoms or no symptoms, and support the staff. And we also advise them to get the link from our website to give to the parents so that they know for the future how to safely monitor with cannabis. So what are the concerns we get from the callers? We get calls from home, and about 20% of our calls last year were home calls. Over 70%, the initial call we got was from the hospital first, is the parents are a little concerned about whether they'll be judged about the fact that their child get into a cannabis product, whether they're going to be concerns with us thinking that the child had some aspects of neglect, or if there's any fears of reprisal. With some parents and do have cases with Children's Aid, and so they're very concerned and will voice to us that they're worried about their caseworker. And occasionally I've given them the chart number and said, okay, if your caseworker does have a concern, they can give us a call. You've done the right thing. You've called the Poison Center, and this, you are looking after your child's best interest. A lot of parents are concerned about us reporting, and that isn't our role at the Poison Center. And definitely during the pandemic, many parents were concerned about bringing their child to the emergency room for fear of COVID exposures. So with regards to child protection services, that isn't the role of the Poison Center to contact protection services with regards to an exposure. but it is the role of the healthcare provider. So if the child does get to the hospital and there is a concern for neglect, then that is their role. But because cannabis is legal, there isn't really a concern of being charged with having cannabis. And also there was a case that we had last year that I think that one of the parent was charged for child endangerment. And that would have been brought forward from the hospital depending on the exposure and how the child did get control or how the product was available to that child, unfortunately. So what we like to focus on is education to help prevent future poisonings. So we really look at the awareness, secure storage, and trying to reduce access. And those seem to be the three things that really will help reduce this in the future. Next slide. So last year, 2019, when we had about a 300 increased percentage of calls, our emergency department, emergency residents, and our lead outreach person, Katie, and one of our specialists, Fiza, they helped collaborate together the following posters for awareness that we finally were able to get out last year, and we're able to send out to the emergency departments. And we discussed safe storage with looking at the brownies. So you can see that kids don't know the difference between delicious or whether it's dangerous. And then we talk about the access. Where is this a trick or is it a treat? Because gummies to all kids look like candy. And so all the posters do discuss about, that it is poisonous and it needs to be locked up. And then the last bit is safe storage. And we say, don't wait to see this. Because unfortunately, this is what happens, that a lot of kids, because they see the candy and unfortunately the parents may have forgotten to put it away, or they do storage in Ziploc bags or bags that aren't secure. This is what we see. So we talk about these safety bags, which have a safety lock. So that's one secure way of looking at safe storage over putting stuff in a Ziploc bag or a baggie or putting it in their purse, because the average toddler can't access it. We've pulled some images off Amazon to look at secure lock boxes, whether it's medication, whether it's edibles, or any other kind of medication. And then we look at these lockable mini fridges. If parents want to bake, or they have a lot of baked goods, or even drinks now that do have THC, think about putting in a lock, in somewhere that's locked, that have minimal access. And then we also look at having these counter boxes that can even go into the fridge. We've also had a lot of adults that are naive that don't realize. So by having a second layer of protection where, if you see something that's locked, even an adult would think twice about opening it because they'd wonder, why is this locked? And it lets you know that it is something that maybe you need to think twice about. We also don't think that, not storing stuff with food products. A lot of parents and people will say, that it's in the cupboard, it's up on a high shelf. And they thought that that would be safe enough to keep it out of reach of the child, or storing it in a Tupperware container, you got to clip it open, but that's easy for a child. So we kind of want to look at having maybe putting things in the cupboard that's out of the way, where there's sort of minimal access, in a high shelf, in a lockbox on top of that, or in a safety bag. So you have those extra layers where it helps prevent a childhood exposure. So, and as we say, you've got to keep everything locked up and out of sight. Thanks.
Thank you so much, Jackie and Margaret. It's one thing to be aware that these incidents are on the rise. It's another to see such stark numbers. I know that just a couple of weeks ago, we saw a new study come out showing, kind of confirming these increased cases in Ontario, not just that these exposures are happening, but also that the outcomes tend to be more and more severe for children, so leading to hospitalization. And the information you've shared really paints that picture for us, so thank you. We will have an opportunity to ask Margaret and Jackie questions. So if that sparked any questions for you, please do shoot those into the Q&A box. And in the meantime, we will move on to our final planned presentation for this session. So Annika, if you want to join us, perfect. I will hand it over to you.
Hi, everybody. I'll just share my screen. Can you see that?
That's perfect, Evika. Go ahead.
Okay, great. Okay, so first off, I just want to say thank you for giving me the opportunity to speak to you today. What I was proposing to do this afternoon is to talk a bit about the cannabis control framework, talk a bit about the monitoring of pediatric poisonings related to cannabis, and then I'll move on. And I've seen that there's a common thread there from the other two presentations in regarding some of the consumer education and public outreach campaigns that we have done, are currently doing, and are planning to do. So just in terms of a bit of context, and it's already been covered, but the Act came into force in October 2018. It created that regulatory framework to enable the sale, possession, distribution, production, and possession of cannabis in Canada. From a public health and public safety perspective, there are some objectives around preventing young persons' access as well as inducements to use cannabis. And there are some objectives around reducing and deterring the illicit market through providing Canadians with quality controlled cannabis through the legal system. So in terms of how the authorities are set up and kind of implemented, Health Canada plays a leadership role in terms of the administration from a regulatory perspective of the Cannabis Act and its regulations, but we also really work quite closely with other federal partners in this space. So for example, Public Safety Canada is responsible for the initiatives around deterring the illicit market. And then other federal departments such as finance as it relates to the taxation issues, CBSA as it relates to border issues, etc. And then lastly, we work closely with our provincial and territorial partners because, as you know, they have the ability to set, they have the ability around distribution at the retail level within their respective provinces. So in terms of the framework itself, there are kind of three key pillars that frame that framework. The first is around restricting access. So I mentioned earlier about prohibiting youth access, controlling adult access, and then continuing to provide access for medical purposes. So Margaret mentioned that that's a program that's been longstanding. It has since been ported under the Cannabis Act framework. Second pillar is to regulate the industry. We want to make sure that we are enabling a diverse and competitive market that's enabled to support our efforts in displacing the illicit market. And then lastly, the education and outreach piece, making sure that we are providing Canadians with the information they need to make informed decisions around cannabis use so that they understand those risks and enable or support the ability to prevent problematic use. And then lastly, as with any other kind of legislative framework, there's a requirement to monitor, evaluate, and report. So we do collect data on a number of elements around the legal framework that touch on measures related to public health and public safety. Normally when an act is put into force, reviews are done within 5 years. When the act was being brought to committee, it was recognized that review needed to be done sooner rather than later, so that review has been accelerated to the 3-year mark of the Cannabis Act. So that review is anticipated to be completed by April of 2023. And then we do research. So for example, we have that Canadian Cannabis, oh my goodness, I lost my train of thought. The Cannabis survey that we survey Canadians to get us data around cannabis use across Canada. So in terms of the regulatory legislative framework itself, there are a number of provisions in both the Act and the regulations that have been designed specifically to protect youth from access and use. So was talked about earlier, there are very strict requirements around packaging and labeling requirements for the legal industry. So plain packaging is required. There's specific rules around font size, the amount of THC that can be contained in a product. And then there's some requirements in terms of what can be placed on the product. So there's the standard health warning symbol, as well as messages that need to be printed on the label as well. There are very strict marketing and advertising requirements that are in the Act and the regulations. It was recognized that to support the legal market, to displace the illicit market, that we need to provide some space for the legal industry to do some marketing and advertising activities, but that space is really tight. So there are, specific provisions in the Act that forbid things that we feel would be appealing to youth. So, for example, the use of celebrity endorsements or affiliations, advertising that kind of alludes to a lifestyle that would be enticing to youth. So there are a number of provisions in the Act that kind of aim to limit, interest of youth for inducing cannabis. And then my team does in fact take compliance and enforcement action when we're seeing that our regulated parties are not meeting the requirements. So I mentioned earlier that we work with our partners in this space. So Health Canada is responsible for the administration of the Act. But once you start to get into activities around that are legal in nature, we then turn towards our partners at the federal and provincial level as well to enforce provisions around the Act. So we work really closely with public safety, who are leading our efforts around preventing organized crime from entering the legal system. We also work really closely with law enforcement, who are responsible for enforcing the criminal offenses related to cannabis. And I mentioned earlier PTs. So PTs have a role with respect to the implementation of the Act and the framework. So they are able to, for example, lower the minimum requirement in terms of access to cannabis. They oversee the licensing of retail within their province, and they can provide or put in place additional rules as it relates to public health and public safety measures. And then local governments are also have a role with respect to bylaws and public consumption, etc. So in terms of monitoring pediatric poisonings, we do that in real time. And there are a few mechanisms that we use to do that. I won't go through them all. They're listed on the slide here, but one example are the adverse reaction reporting reports that are available on our website, where people can go and provide information around the adverse reactions they're experiencing. There's a cannabis complaints form, so that you can imagine encompasses all complaints that we see with respect to the cannabis space. And then there has been an inbox that's been set up specifically to enable Canadians to provide to exchange information with us, and that's through the cannabis@canada.ca inbox. And then, as I mentioned, if we are, as we're triaging that information and we're seeing that there are issues that are around that are illegal in nature, we refer those to law enforcement for action. So in terms of some of the kind of the education awareness pieces that we've undertaken as of late, we issued a public advisory in August of 2020, and then we've since updated it, and it was released in December of 2021. And that was as a result of some of the hospitalizations from children inducing cannabis edibles. So we wanted to provide Canadians with some information around, what to expect or what's a legal product that Canadians can purchase. So that public advisory that was issued in December had some pictures as examples, and they were in Margaret and Jacqueline's presentation, so that people can understand and make the distinction between what's sold in the legal market versus the illegal market. We also provided some information or links to safe storage practices as well. And then the last kind of element within that public advisory is something that we stood up as of quite recently, which is links to authorized retailers that are in each province. So you can click on the link for the province, and it'll bring you to a comprehensive list of the retailers within that province. So this is just some of the examples of the pictures that were included in that public advisory. And then in terms of other public education campaigns, we've done quite a bit of work around that leading up to and since implementation of the Act. And we use a number of tools to do that. So we do national campaigns targeted to populations at highest risk. And we do community-based support programs. So for example, in from November to December of last year, through our substance use and addictions program, we had a micro grant program that was available. So individual organizations could come in and submit an application to obtain up to $1,000 grant for public education awareness campaigns. So I kind of mentioned some of the things that we've done as of late. I mentioned the retailers list. We are planning on doing additional social media campaigns this year. And then public safety also has done some public outreach on their webpage. Our provincial colleagues have done some public outreach as well. So in November of last year, the OPP did publish a release around why you need to drop your dealer. And it was as a result of some studies they did around illicit products to demonstrate what can be found in those products versus those that will be found, those that are created and sold within the legal market. The OPP has also launched a series of Crime Stopper videos, and other provinces are doing similar public education and awareness events. So I've included some links there for reference, and I think there were a few before, but anyway, I'm going to stop here, and I hope that was helpful.
Thank you, Annika. It's really helpful for us to understand, the regulatory pieces that have come along with legalization and the ways that these contribute to safety for this issue. I think there had been a question in the Q&A about sharing out slides. So long as we get permission from the presenters, we will do that, and you'll be able to access some of those links that Annika has shared, and we can share that alongside with the webinar recording. Okay, so that ends our formal presentations, and we do have, this is a 75-minute webinar, so we have just under 15 minutes for a question and answer period now. So I'll just ask our speakers to turn their cameras on, and I'll invite Claire to join us to help facilitate the questions and answers.
Great, thanks, Steph, and thanks to all of our presenters for those excellent presentations. I'll start the questions off. We do have a couple questions in the Q&A already, but if you're still sort of ruminating and taking in all of the presentations, I encourage you to enter your questions into the Q&A, or you can use the chat box as well, and we'll hopefully answer those in the next couple of minutes. So I'll start with a question for Annika, since we just wrapped your presentation there. So Tony asks, where are the products that do not meet requirements generally from? So the Stony Patch Kids packages that we saw in Margaret and Jackie's presentation, and then you also showed a number of illegal products in your presentation as well. So can you elaborate on where those products are found?
Sure, so we know they're coming from various sources. Some are coming in from the US, for example. We do some work with the Canada Border Services Agency. They do come to us when they are, seeing packaging, for example, that, is not meeting the requirements of the Act. And then I think as well, in terms of the source, there's criminal activity that's happening within Canada. And so that's why, like I mentioned, how public safety is working towards efforts to help reduce that illicit market.
Great, thanks. And I know this is a really hot topic, so we're actually planning our second webinar of this series to really dive into illegal versus legal cannabis products, sellers, and packaging. So if you're interested in that, please do look out for our next webinar details, which will be coming out shortly. So thanks, Annika. So next question is for Jackie. So Patty Stark asks, is it possible to access some of your education resources to adapt for use in Alberta?
I think it probably could be. We just checked with our director. I'm not sure what educational. Right now we've got is the poster she's looking at, or what was it that educational? Like, we've been posting stuff on Twitter, and hopefully once the Canadian website's up and running for the Poison Center, they will actually have very similar, actually pretty much identical, just different backgrounds for the Canadian Center is what we've just, I think, worked out this week. And then they'll be available to all the poison centers across Canada. If she's looking at the poison awareness posters, we are developing them for the Canadian website so that they will all have access to the brownies, the gummies, and the trick or treat gummy bear ones. I'm not sure if that was the question, Patty.
Yeah, I just confirmed here. So she said yes, the posters. So
yes, we've just got the green light last week from the development team who developed them, and they're more than happy to launch them onto the Canadian website when the Canadian website gets going. And then all the poison centers will have access to them, and they will just be slightly formatted more towards the Canadian colors of which I think are red and white for the Canadian website once the Canadian Poison Center relaunches, and everyone will have access to them for awareness. So keep tuned, Patty.
thanks, Jackie. So we have a couple of questions about the Ipsos survey that we ran, Steph. So Sandra Newton asks, are there any differences between English and French participants, or any regional differences that you could share with us?
Yeah, so I don't have that in front of me today, but what I can certainly do is pull that from the material that we have, and that's something that we can share as a follow-up to participants. Would be happy to provide more information on that.
Thanks, Steph. And we also have a question from Jody. So did we ask participants about the best way to get information to them in order to raise their awareness? So identifying some preferred methods of learning about cannabis, storage, exposure, and other things like that.
Yeah, so there was an important question to ask around, especially for informing our campaign. The way that we asked the question was, in 2019, we asked about whether they had recalled seeing campaigns, messaging communications around this topic, and where they recalled seeing those. Just to get at not only where do they access information, but when they see information, where did they see it where it impacted them, where they could actually recall that later on. And so I pulled up some of those results, and really the top places that the parents recalled seeing information for sources of advertising and messaging on this topic were on Facebook, on TV, on YouTube, really Facebook and TV being at the top, and then some other examples of social media such as Instagram. And we have found through our implementation of our campaign so far that the social media route has been quite successful in terms of with funded campaigns on social media being able to really target our information. And in 2021 survey, I didn't share that today because I wanted to focus more on the general messaging, but we did ask about the recall of Parachute campaign and messaging, and the highest level of recall was through social media. So that tells us that's a good channel for reaching that audience that we were targeting.
Great, thanks. And Jody had a second question, which I'll open up to our other panelists as well, just to kind of speak to opportunities or experiences working with cannabis retailers themselves to provide information about poison prevention.
I can kick us off, and then I'll let others step in. That is something certainly that is on a provincial and territorial basis. So, Parachute has identified that as a channel and talked with some of our partners about that, and we're aware that some of our partners have looked down that channel as well. I believe that Alberta, the Injury Prevention Center in Paddis, we're looking at that type of approach. So we certainly see point of sale as a really kind of targeted space to get that information across. But it's going to vary by province and territory for sure in terms of what regulations are in place for what needs to be or can be in those licensed sailors, especially the brick and mortar stores, or actually on the websites. There is some regulation around what they have to have in terms of educational materials and what they can and cannot have in those. So I'll stop there and see if anyone else has more to add, more experience with that.
So I can just add, like, well, Stephanie's right, like the authorities around that they really reside with the PTs, but I'm happy to take that suggestion back, because we do talk to our PT colleagues on a regular basis, and that could be something I could put on the table for them for consideration.
I was going to say, from OPC, we're hoping for Poison Prevention Week to be able to collaborate. We're getting the safety locks, and we're looking at having like pop-up box stands with our poison prevention information. And once we get the pop-up box stands organized, we wanted to reach out to some of the retailers to see if they would put them out there, the free locks that would be available for safety. And I'm hoping that they would be receptive to that, because at the end of the day, it's just going to help their business also.
Great, thank you. I have another question here, I think, for Annika. So the original reasons to legalize was to reduce organized crime and reduce youth availability to cannabis. So do you feel that we've hit those targets? There's been some, talk that local schools, namely high schools, are seeing a spike in cannabis use, which is also driven from vaping industries. So do you have any thoughts on whether or not we've hit those targets of reducing youth availability to cannabis?
So I think I appreciate that question. I think what I would say is that, there's some stats to support kind of the sale of legal cannabis that Stats Canada has recently released. So for example, between June and August 31st, 2021, there was approximately $1 million in cannabis sales across Canada. So I think we're seeing a positive kind of result as it relates to legalization. I find a bit challenging to talk about the cannabis vaping, because it is an unauthorized, it's not authorized, like we're, regulated, or the industry is not authorized to sell, illegal or vaping cannabis products to youth. And just to further that, we just recently published in the Canada Gazette, which is the mechanism we use when we want to make regulatory change, some additional changes we want to make to address the cannabis vaping products, because we don't want to see what happened with the issues around tobacco vaping products that we saw. Marketing is a big piece of that kind of puzzle, and we want to make sure that we're getting ahead of that from a cannabis vaping perspective. So some changes were proposed in the regulations earlier this year. So, and then maybe the last point I'd say is that I mentioned earlier that there's that legislative review that's required to happen. And there's three particular areas of focus for that legislative review. And one is around, the health and consumption habits with respect to young persons. So, I think that there's going to be some evidence that's going to, inform some advice and recommendations as a result of that review as it relates to that area of focus.
Great, thanks, Annika. I have another question here for you. So do you know any strategies that have been used by any provinces or territories in terms of increasing the limit in cannabis possession for the public?
That was for me. So could you reread the question for me?
Do you know of any strategies that have been used by any provinces or territories in terms of increasing the limit for cannabis possession in public? So I guess they're sort of asking if there's any value in increasing that limit.
So the act kind of sets the stage in terms of that, that requirement. Provinces can further restrict, but they can't go above what the federal government has outlined in the Act and regulations.
Great, thanks. And I think we're just conscious of time here. We're nearing the end of the webinar, so I'll stop it there. And Steph, if you wanted to wrap us all up here, and I'll just say again, a huge thank you to our panelists on behalf of Parachute.
Thanks, Claire. Yes, thank you to all our speakers, Annika, Margaret, Jackie. Thank you to all of the participants. Really great to see all these questions coming through. We will be following up, as I said, with a little bit more information as promised, as well as we will let you know when this recording is available. So thank you all for being here today. A reminder, as you leave, you will be prompted to complete an evaluation survey, and we really appreciate your time to do so. Thank you, everyone. Stay safe, stay warm, and have a great rest of the day. Take care.